Leprosy, also known as Hansen's disease, is an infectious disease that is caused by Mycobacterium leprae, which is an acid-fast bacillus that grows best at 27 to 33 degrees C. And the most important reservoir for Mycobacterium leprae is armadillo. And the fact that armadillo's temperature is 34 degrees C makes it an important reservoir for Mycobacterium leprae. So this bacterium can grow easily in the armadillo. At the same time, since the 27 to 33 degrees C is the ideal temperature for Mycobacterium leprae, the skin and peripheral nerves are the tissues that are most commonly infected. Now, there are two forms of leprosy. The first form is the lepromatous leprosy, and the second form is tuberculoid leprosy. In the first form, patients will have palpable thickening of the skin and the loss of hair in the eyebrows and the eyelashes, and thus because of these features they would have leonine faces. And this condition is communicable. So here is an example of a leonine faces. So you can see the palpable thickening of the skin as well as loss of eyebrows and the eyelashes in this patient. Now with the lepromatous form, body induces the Th2 humoral response, and the Th2 will block the Th1 response, which is the cellular response. So therefore, since the cellular response is downregulated in these patients, they would have difficulty clearing the infection. In the second form, patients present with the hypopigmented / erythematous anesthetic lesions, and they induce the Th1 cell-mediated immunity, which would make it possible to kill the intracellular organisms. As for the treatment, we will have to use the multi-drug treatment for both of these conditions. So the first condition, since there is no cellular immunity, we will have to treat with 3 different drugs: dapsone, rifampin, as well as the clofazimine. And you should use these for about 2 to 5 years. And the reason for that is that there is no cellular immunity in these patients. In the tuberculoid form, however, since there is already Th1 cellular immunity, which would help to kill the intracellular organisms, you will only have to treat for 6 months with dapsone and rifampin. Now, one feature that I would like to remind you is that Mycobacterium leprae and Mycobacterium tuberculosis, so they're both from the same genus. They're from Mycobacterium. So both of these organisms are acid-fast bacilli. And one other feature that is similar in both is that you will require multi-drug treatment for both of these conditions. And the mnemonic that you can use to differentiate lepromatous from tuberculoid leprosy is lepromatous. So L goes for leonine faces, that is associated with lepromatous leprosy, and 2 goes for Th2 response in these patients, which will block the Th1 cellular response. So just keep that in mind. Lepromatous form is associated with leonine faces and induces the Th2 humoral response. And that concludes our discussion.